Thanks, Chairman. Appreciate it. Dr. McCants-Katz, welcome. Good to see you again before the committee.
Thank you.
We, in the negotiations around CARA and the Cures Act, got a commitment, bipartisan commitment, for an extra $1 billion to be spent on opioid treatment. The first half of that was already distributed, and we hope and expect that the second half of it will come through in the end of this year funding measure, whatever that ends up looking like. We're very much counting on that. In the last one, the measure by which the funding was distributed to states didn't correlate to the rate of the opioid epidemic, the intensity and severity of the opioid epidemic in that state, nor did it connect to the recently passed CARA bill. I'm hoping that as we move forward on this, you'll be in a position to structure the grant process for that second $500 million in such a way that it more accurately addresses the high-impact states and that it better connects to the CARA bill. I think you can probably do that in the terms of the grant application request that you structure from SAMHSA. I just wanted to hear from you where you plan to go with that, because the high-impact states kind of got not treated so well.
So my understanding of this situation is that if we make any kind of changes to the previous funding announcement, then all states would have to reapply for the money. I can just tell you that we've been hearing from lots of states about their concerns in having to reapply for the money, and the decision was made to not have any substantive changes in the second year of funding for that 2 years, that $1 billion, $500 million each year.
So for the sake of the process convenience for all, the high-intensity states are going to pay the price.
So I would say a couple of things. One, when that decision was made, I did go back and we looked very hard and we did find money, and we put a new funding announcement out that does prioritize those states that have been hardest hit by the opioid epidemic. I will continue to do that. In addition, the other thing that I've been able to do is to reallocate funding so that we're building a new technical assistance program that will be individualized to every state. So those states that are hardest hit, who have certain types of special needs, we will have local technical assistance available to them that we think will be important to helping them implement as efficiently and effectively as possible. Going forward from that 2 years of funding, whatever Congress and the President decide upon, we will look at that and we will be very much aware of the kinds of issues you've just raised.
And please also be an advocate for additional spending in this area in the CARA programs in particular. I think we were able to get $170 million in the last funding measure. That's 2% of the $8.6 billion that the pharmaceutical industry makes selling just the prescribed opioid products, setting aside the illicit stuff that comes over the border. So 2% up against the devastation that we're seeing in the context of a multi-billion-dollar industry, I would consider a beachhead, not a victory. I hope you agree.
Yes, sir.
Last quick thing, this is a Rhode Island specific thing. The Health Insurance Commissioner, as you know, in Rhode Island is taking a look at the parity compliance of the insurance companies in Rhode Island, and I know you're looking at that at the national level. Can I just make sure that you've got somebody on your staff coordinating with Rhode Island to make sure that you're supporting their work and everybody's pulling smoothly together on parity disclosure and enforcement?
Yes, so two things. One, SAMHSA has developed a parity toolkit for insurance commissioners that we've made available to all the states. And two, we have an office of around healthcare reform issues, and that we have a person who works individually with the states and with insurance commissioners within the states.
Terrific.
So we'll make sure that that happens.
Time's up. Thank you. Appreciate it.